We begin tonight with two major public health headlines, early indicators that this year's flu strain is shifting away from what the vaccine targeted, and Canada losing its measles-free designation. So what's ahead for the season as far as the flu is concerned and measles? And is it a part of the whole thing around vaccination fatigue? Joining us now is Dr. Wayne MacDonald. He's a former Chief Medical Officer of Health for the province of New Brunswick. Wayne, thanks for joining us this evening. To measles, where we have lost our measles-free designation. And I know you and I talked probably about a month, maybe almost 2 months ago now, about at that point, you were concerned that we were headed in that direction. And then all of a sudden, bang, here we are. What do you attribute it, all of a sudden the surge in measles in this country? What do you attribute that to?
So just a little bit of background. To be called measles-free, that's kind of the common term. It's measles elimination status is what the it's called in the kind of the public health world. And we achieved that in 1998, and that was done by we went from one measles vaccine to including a booster. So we were about 90%. When we were really, really good at getting vaccines, we had about a 90% coverage from one booster, from one immunization, which wasn't enough. Measles is so infectious, it's one of the most infectious diseases known to man, that you need a 95% vaccination rate for herd immunity. And most people know what that is, but just to recap, that is immunity, 95% of your community is immunized. So if you do get measles in there, it doesn't have very far to go, and it hits that brick wall of people protected, and then it just is gone. You stopped it. But if you go below 95%, it is so infectious that it can find those uninfected people, unprotected people, and just spread. So in the 90s, we went from one vaccination in, I think, early childhood to the second one around age 5, depending on the province. And that brought, if you got 2 immunizations, it brought your protection up to about 98%. So that provided a nice protection. And once we did that for a couple of years, we did not have any ongoing transmission or continuous spread of measles within the country. So that allowed us to be called measles-free or achieve measles elimination status. So in order to do that, you cannot have transmission of a particular strain of measles in your country for more than a year. And so we met that criteria. Now, what happened between, just an example, between 2020 and 2024, Canada averaged about 91 cases of measles a year. So you might say, well, gee, we had measles. The bulk of these cases were imported. In other words, somebody got infected in another country, and remember the incubation period for measles is fairly long. It can be up to 21 days. The average is about 10 days. So from the time you were exposed to the time you get sick, it's 10 days. You don't even know that you're sick yet, and you can actually start transmitting it a couple of days before you actually get symptoms. However, we averaged 91 cases a year between 2020 and 2024. Now, we are currently in a large multi-jurisdictional outbreak that began in October of 2024 in New Brunswick. Somebody flew in from out of country that was infected, attended a group area for a wedding, and then when the wedding was over, people went back to other places in the country, and they happened to go to, in particular, places that were very, very low vaccination rates. For whatever reason, either religious belief or just not in tune with what was happening with immunizations or understanding the importance of them or having access to them. And it just spread from there. And it was so infectious, and I was on the show earlier and said, but it's the kind of thing that it's R factor, which is the reproductive factor. But basically what it means is if somebody's infected with measles, they have the potential to spread that to 14 to 18 other people, to make them sick if they are not protected. That is how infectious it is. If you can just think about that, one person in a community that is not protected, or having the immunization, 14 to 18 other people will get sick from one person. It's so infectious that if you go into a room up to 2 hours after an infected person left, of course, depending on ventilation, you can still get it, either by touching surfaces or in the air. So it is that's how infectious it is. And so once you get it and it starts spreading, it's a nightmare for public health to try and do contact tracing, because there are things you can do once you find a contact to try and stop that person from getting it, or to stop them from spreading it somewhere else. But it becomes a nightmare, and eventually it just gets out of hand. You don't even know where the contact came from. And that's when it gets into the community. And that's what happened here. This ongoing multi-jurisdictional outbreak of measles, which started in New Brunswick and spread to multiple other provinces, has been going on. And it's the same strain. You characterize the strain in the lab, same strain for, well, not every case, because we've had some imported cases from outside, but the vast majority, or most of them, are the same strain that started a year ago. And because it's gone greater than a year, the Pan American Health Organization, which is the North American office of the World Health Organization, said, sorry, you've lost your measles-free status. So the only way we can get that back is to, we can reestablish our elimination status by once transmission of this measles strain associated with the current outbreak is interrupted or broken and is no longer being spread, through the country or through a jurisdiction. So that's going to take a lot of work. And what the Pan American Health Organization did when they communicated with Canada, that's saying, hey, you lost your measles status, your measles-free status. And they also noted, look, you guys need to improve. Now, these aren't conditions to get back our status, but they said you have to improve your surveillance abilities. You have to improve your data sharing. And what really is meant by that is, right now there's only a few provinces where if Eddie, let's say you move from Quebec to another province, and the two provinces did not have the ability to see what your medical records were or the status of immunizations. And if somebody said to you, well, have you had your second measles vaccine or some other vaccine? Well, gee, I don't know. My family doc retired. I don't know where the records are. Or I got it out of VON office when they were in business, and they've gone out of business, so I don't know. Well, if we had a good cross-country data collecting system, they could just easily go in there and say, okay, yeah, you had measles on such and such a date, so yeah, you're fine, or you need a booster. We don't have that. There's only a few provinces that can actually talk to each other on some sort of limited basis. And that's one of the things that the Pan American Health Organization said, you have to improve this. Like, you need a national database that is interchangeable, that people can find out, or even public health officials can say, okay, in our province, we know that this age group, so much of this age group is immunized to this extent. And it helps you to focus on, well, this is where we need to concentrate our efforts. The other thing they mentioned was that your vaccination coverage has to improve. Our rates are low, and in some areas they're great, they're okay. In other areas they're really, really low, below 50% or lower. And so we had to find ways to improve that.